Hello, check 1, 2, 3, check. I hope my mic is working fine. Good morning. Hello, this is Shahid Naseem, and we are here again with another live session of the Disorders Care. So, I welcome all of you to this YouTube channel where we talk about different kind of disorders, any kind of mental conditions people usually go through, and all the mental and spiritual challenges we face in our daily lives. So we talk about those challenges in some of the uh, in some of the region. These challenges are taboos, and people usually don't talk about it. Or if they are going through these challenges, they feel some kind of a shame, or typically the approach about these taboo, these conditions are not really promising. So we talk about these different disorders, these different mental conditions, mental challenges, and we discuss with you. So once again, I'm going to talk about ADHD. It's very important, attention deficit and hyperactivity disorder. And for the last few decades, it's we have been seeing quite an increase in the cases of this disorder. It's a condition, and some new researches has popped up in the last 2 to 3 years. So I'm going to talk about those new researches and the kind of treatments we can have for these conditions. So today I'm going to talk about 5 really promising research updates. I'm really sorry about the background noise. I'm in my office, but still these noises are coming. And if my audio is, or if my audio has any kind of a problem, please do let me know. I'll try to fix it. In fact, let me check if my audio is okay or not. The this or this. Then I'll start talking about our today's topic, the disorders care, the ADHD, and its new research about ADHD. Let me check my audio first if everything is okay. Audio check, check. I think we are good. I think we are good to go. Okay, so there you go. Let's talk about ADHD treatment. So today I'm going to talk about 5 really promising research updates about ADHD. So hang on with me, and first of all, before I start talking about these promising updates, I want you to know that these are all research things. It's not a set pattern, or it's not a definite thing. It's not decided. It's not the end of the road. It's not a result. It's just a research. We are still trying to explore this. So do not take this as as a treatment, or do not apply this on your child or somebody in your care, or if you personally going through with these kind of issues or ADHD. Do not personally apply these things on your life until unless you consult with your physician or your medical professional or whoever is giving you an expert opinion on this. So let's begin into it. Okay, research into the mysteries of attention deficit hyperactivity disorder (ADHD) is booming. By really early in 2017, more than 31,000 research studies and papers have been published in medical journals about this most common childhood mental disorder that now affects an estimated 1 in 12 kids and teens. As I've told you before, the numbers are really surprising, and in last few decades, the numbers are growing on a very rapid pace. So someday we're going to talk about why these numbers are increasing with this much speed. So, but today our topic is promising research updates. 5 really promising research updates. Okay, so among the most recent are a handful that offer fresh insight for parents, teachers, and physicians who care for people with ADHD. Mostly, these are parents or siblings who deal with these kind of things. So, brain scans. 2 ADHD medications can be better than one. Research tells us that 2 ADHD medications can be better than one. When 208 kids and teens sorry, when 208 kids and teens ages 7 to 14 received the ADHD medications, guanfacine, it's a name of a medicine, and as you know, my pronunciation is not really good. Or there's some other medications. I'm going to skip those names. If you want to know the name of the medications, I'll share that with you later on. or both drugs for 8 weeks. Researchers from the University of California, Los Angeles found that those taking the combination got the biggest improvements in attention. Now, this is a very important thing. Those people who were getting both medications, they have the biggest improvements in attention. Brain scans showed improvements in brain activity related to better thinking skills and improvements in ADHD symptoms only in the combo therapy group. Those taking demethylphenidate or the combo also saw gains in working memory. Take home lesson. The researchers say combining stimulants like the methylphenidate with medicines like guanfacine, which acts on brain areas involved with attention, control, and impulsiveness, appears safe and could have long-term benefits for children and teenagers with ADHD, including those already showing improvement with one medication. They note that parents should be aware that double therapy with a stimulant plus guanfacine could raise risk for dehydration and fainting. So this is very interesting. The second one is Scontular. Fidgeting may improve memory for some with ADHD. Now, this is very interesting. I used to have this fidgeting device here with me, and though I do not have ADHD, or maybe I do have, because in Pakistan we don't really get checkups for these kind of things. And if you are on a spectrum from the scale of 1 to 10, if you are on somewhere around 1 or 2 scale, you don't really get a diagnosis for that. So maybe I do have ADHD, or maybe some of us do have ADHD, but I don't know. The point is, I used to have this fidget with me, and this fidget was really interesting, and it really helps you cope up with your mechanism or your conditions, or your if you're going through something, it really helps you. So these fidgeting can be very important, very helpful for you, and it may improve memory for some with ADHD. As I've repeated myself again, for some with ADHD. People with ADHD often face challenges when calling on an important brain capacity called working memory. The ability to process information such as while solving math problems or answering science or history exam question. In 2015, a research from the University of Mississippi Medical Center has found that hyperactivity in ADHD seem to help kids learn rather than hindering them. In 2016, Florida State University researchers set out to see if children really turn to movement specifically to amp up working memory. In test of 25 boys and girls ages 8 to 12 that involve remembering small random list of numbers and letters and putting them in alphabetical or numerical order. Sometimes researchers told the children how many items would be in the test, other times they didn't. The kids moved 25% more when they didn't know what to expect. It's another piece of evidence that the hyperactive behavior more and more seems to be purposeful for them. This was said by lead researcher Michael Koffler, who is assistant professor of psychology at FSU. This movement is how they get the juices flowing. Now, take home lesson from this. Koffler is developing new non-drug treatment aimed at improving working memory in people with ADHD. Movement could be component. For now, it's helpful for parents to understand more about this behavior. It may also help explain why some research has found kids with ADHD perform better on tests after exercising, they note, as it did for adults in the next study. So fidgeting or movement or exercises could really help uh, jog your memory, or it could help you regain or some. The thing is, it could have a positive effect on your memory or your working memory. Let's talk about memory first before I move on to the second part. If I think most of you people know about how does this work. We have this memory box which help us learn the language, and that's why if you learn a language in early years of your age, for example, when from 1 year to 6 or 7 years, the language you learn through memory box. You do not learn it by learning it or memorizing it. You learn it through memory box. That's why it comes to you very naturally. You don't have to think about it when you speak. You just speak the way you want, and if any idea come into your mind, you just start talking and you go on. So it doesn't really affect your it really helps you communicate if you're talking with your mother tongue. But the moment you switch to your secondary language, it becomes a bit difficult. You have to think about it. Like, for example, You can see that my English is not that great or not that fluent, because it's my second language. It's not my first language. My first language is a dialect of a Punjabi, which is called Pothohari, or the Urdu. It comes naturally to me. So when I'm talking in these languages, I speak really well. But when I'm talking in English, it takes me a bit of it takes a bit more time than usual, because I have to jog up all these words from my memory, not from the memory box, but from the memory where I memorize all this information. Okay, so off the couch, boost mood, energy, and motivation with the little exercise. Third number. After pedaling on exercise bikes at a moderate pace for 20 minutes, 32 young men with ADHD felt more motivated and energetic and less fatigued and confused. Sorry. While doing memory and reaction time tests, than when they sat and rested beforehand. The test was stressful. One test involved remembering numbers and letters that flashed on a computer screen for a few milliseconds. The other involved pressing a button when a red circle appeared for a moment on the screen. For a moment on the screen, getting active didn't boost performance, but study volunteers felt more positive about taking the test. Report researchers in this 2016 University of Georgia study. This was said by them. Now, what is the take home lesson from this? Exercise is already known as a stress reducer and mood booster, so it really has the potential to help those suffering with ADHD symptoms. This study's senior author, Patrick O'Connor, professor in the UGA College of Education's Kinesiology department, noted when the study was published. As he said, and I quote, and while prescription drugs can be used to treat these symptoms, there's an increased risk of abuse or dependence and negative side effects. Those risks don't exist with exercise. Now, this is a very important and very interesting thing. Obviously, when you are using drugs or medications, there is a potential risk there. But when you are exercising or when you are doing some kind of a therapy which doesn't really include drugs or these kind of things, it doesn't have any side effect mostly. So that's why I always tell you that you should talk to your doctor, or you talk to your medical professional, whoever you have with you. Okay, number four, winning points, extra rewards are big motivators for kids with ADHD. Now, in a 2015 University of Buffalo study of 58 kids ages 9 to 12, 25 with ADHD, 33 without. Children with ADHD worked harder and boosted their performance on memory and reaction time tests more when they won points for improvements. So extra rewards are big motivators. That what was striking? The extra reinforcement motivated them more than it did kids in the study who did not have ADHD. The researchers note. And what is the take-home lesson in this scenario? Celebrating good work with a fun reward can be a powerful way to help kids with ADHD do their best. Number five, web tool for doctors. Program leads to better results for kids with ADHD. A web-based software program that lets pediatricians see and evaluate reports from parents and teachers led to bigger drops in ADHD behavior symptoms compared to patients of pediatricians who didn't use the system. According to a 2016 Cincinnati Children's Hospital Medical Center study, researchers say the system chosen by the American Academy of Pediatrics for a tryout as a part of a five-stage test to improve primary care for kids with ADHD helps doctors choose the most effective ADHD medication. The study tested the program called myadhdportal.com in 373 kids at 50 pediatric practices. Parents' rated symptoms were about 30% lower in kids whose doctors used the program. Now, what this means? This means the program is now commercially available to medical practices. So this is something which was very intriguing for me. Now, the new treatments. Now, there's this question which was asked to me a few days ago, that a treatment for kids and adults, which one is right for you? So how do you determine that you are an adult and you need this kind of, because you cannot exactly say a 14 or 15 years old kid is an adult or he is not. So he may fall in one or the other thing. So this is a really good question in this scenario. First, FDA approved device for ADHD. Could mild electrical pulses delivered to a major nerve of the head and brain ease ADHD symptoms in kids? That is a question. It's a question mark here. In 2019, a small University of California, Los Angeles study of 62 girls and boys ages 8 to 12 with moderate to severe ADHD found that 52% of those treated with the Monarch external trigeminal nerve stimulation ETNS system for 4 weeks had significant reductions in inattentiveness, hyperactivity, and impulsiveness. In comparison, just 14% in a control group saw improvements. This study was published in the April 2019 issue of the Journal of the American Academy of Child and Adolescent Psychiatry. I'll come back to this para before again, but let me complete this first. In the spring of 2019, the US Food and Drug Administration approved the marketing of the prescription only device for children ages 7 to 12 with ADHD who are not taking medications for the condition. It was the agency's first okay of a non-drug device for the treatment of ADHD. Now, how it works? Kids wear the ETNS unit at night, clipped to their pajamas. A wire sends low-level electrical pulses to an adhesive patch placed on the child's forehead, just above their eyebrows, like here. And they may feel a slight tingling sensation on their skin. Now, studies suggest that ETNS stimulates the carnal nerves in the forehead, which in turn stimulate various brain areas implicated in ADHD, such as the anterior cingulate, insula, and frontal lobes, explains the ETNS researchers Sandra K. Lu, who is a PhD director of pediatric neuropsychology at UCLA's Semel Institute for Neuroscience. The brain areas that are indirectly stimulated by ETNS are thought to improve certain cognitive abilities called executive functions, such as inhibitory control and working memory, which are impaired in about 50% of individuals with ADHD. Both executive functions and ADHD symptoms seem to improve together with ETNS treatment. Now, as I've told you before, that I'll get back to the first part, and which is that only 40% in a control group saw improvement. This study was published in 2019 April issue of the Journal of American Academy of Child and Adolescent Psychiatry. So this pushed me really on the edge that why should we go with these kind of treatments? But as I've told you before, we are still searching in this area. We're still struggling in this area. We don't know really much about how human mind works and what is going in there. So this is something we're going to work for a very long time, and the end is not near. We cannot say with certainty that will the next 2 years or 3 years or 4 years we're going to figure it out. So it might take longer than that. So we are still struggling. We are still searching about it. We're still exploring. So all these researches help us every day. They help us understand a bit more about our the human brain. How does it work? So that's why you have to take it very seriously, and that's why you have to be very careful when you are practicing these treatments. Okay, moving forward, this is just to let you know if you're from US or in that particular area, does insurance cover it? The $980 system is approved only for kids only 7 to 12 who don't take ADHD Do we have more sound? Thank you so much, Khatija Shakil, for reminding us that each time I do this live session, I have this problem. Sound tells us that I check. Check. Okay, audio is good. Okay, audio is good. Okay, I'm really sorry about this. These technical glitches are continuously happening with me, and I'm really sorry about this. Forget about these kind of things. And yesterday I was doing this session, and the camera was off. So I'm really sorry about it. Okay, what we're discussing? We were discussing about what should a parent do if they suspect their child has ADHD? I've been asked this question for so many times, and I've tried to answer this in different ways. Though I've explained this that I'm no expert in this area. I'm not a medical professional. I'm no expert on ADHD or symptoms, but I've been working on these different disorders for a very long time, and I've been researching about this. I've been